quality techniques used in project management, quality techniques used in operational improvement. And it is applicable to all the processes, and it is applicable to all the industries. So the best part about Lean and Six Sigma tools and techniques is that it is applicable to any organization. And the tools and techniques which we are going to learn today will be helping you to do a small improvement project. If you want to improve a process, if you are working in a hospital, then you can improve your hospital process. If you are working in a construction company, you can improve the construction company. Once again, welcome to everyone. If you can just, yeah. So if you can just write down in your chat box which industry you belong to, so that will give me a little bit of idea. I know a lot of people are from hospitals today. A lot of people are from different industries as well. So I'll try to cover the tools and techniques and the examples related to almost various types of industries. And just to give a little bit of introduction about myself, I have been doing Lean and Six Sigma improvements and quality related topics I have been covering, including the CPHQ project management trainings for the last 33 years. And I've completed lots of improvement projects in hospitals, in petrochemical industries, and even in banking industries. So with that, once again, welcome everyone. And now let me introduce you to the basics of, so how we'll be proceeding in this program would be that I'll introduce you to the what are Lean and Six Sigma benefits for any hospital, any industry, any construction industry, any petrochemical industry. And what is DMAC? Define, measure, analyze, improve, and control. And what we will do, we will try to do a project. We'll collectively try to do a project. And when we are learning the tools and techniques like SIPOC, process mapping, we'll also learn run chart, control chart, the concept of control chart. So as we learn these concepts, we'll apply these concepts to improve a process. And I'll choose a simple process, a process which everyone can correlate to. So the process could be related to, let us say, recruitment cycle time, reducing the recruitment cycle time of our employees in our organization. So we'll try to use that as a project. And we'll try to learn a tool and apply the tool and technique to our project. So we'll see Lean and Six Sigma applications. I'll try to give 5S or Lean applications in healthcare also, because we have got a lot of people from healthcare as well today. And then we'll talk about, we'll have some discussions. So this program is around for 2 hours. And just to give you a little bit of introduction, I'm basically a chemical engineer, did my CPHQ, PMP, data scientist course. And after that, I have implemented Lean and Six Sigma in more than 100 organizations around the world. And I also conduct the CPHQ sessions, PMP sessions, and Lean and Six Sigma Green Black Belt. Also, I conduct artificial intelligence and data science sessions too. So all are correlated. The tools and techniques and the quality related tools and techniques are almost same. So on that note, let me begin the session. Now, can you find some similarities here? A manufacturing company improves the production by 30%. A hospital reduces discharge time of patients from 3 hours to 15 minutes. There's a 64% recruitment time reduction in a multinational company. A hotel improves the customer experience, and a bank reduces errors and cycle times by 80%. What is common here? What are the things which are common here? Can you make a guess? And this program is being recorded, so you'll get all the recordings. And I'd like to special welcome the CPHQ and PMP candidates, where I'm going to describe all the tools and techniques which are used in our syllabus. So we can see that one of the common themes running is that all of them are talking about improvements, and all of them has used Lean Six Sigma techniques. So what is Lean and Six Sigma? Lean and Six Sigma is about improving anything in organization by converting the improvement opportunity into projects. So Lean Six Sigma implementation will help you in reduction of costs, reduction of defects, reduction of waste. There are 7 or 8 wastes, reduction of rework, reduction of cycle time, improvement in quality, improvement of production efficiency, improvement in productivity, customer satisfaction, profitability, and resilience. So all these things are going to improve the business processes of your organization. Okay. So let me introduce you to what is basics of Lean and Six Sigma. Now, Lean talks about reducing the waste in the system, and Six Sigma talks about reducing the variation in the system. So let us take maybe some example. The first, in Lean, we have to look at the value. Think of the value from customer's perspective, not from your perspective. Say, for example, in this particular training program, you are my customers. So what is the value you are looking at? The value you are looking at is learning the quality tools and techniques which can be used to improve the processes in your organizations. That is the value you are looking at. But suppose I tell you to deliver that value, earlier we used to do a lot. To deliver that training, I make a booking and I go to take a taxi, go to the airport, take a flight to your city, then I stay in a hotel. All these things are not related to the value which you are looking at, although they are going to enable the value to be delivered. But the real value is transfer of knowledge, learning of tools and techniques. So the learning of tools and techniques is the value which you are looking at. And this value would be delivered only and only if you are following the steps which are directly creating value for the organization. Now, when you map the process, in Lean, what happens? You map the process. You use process maps. When you are mapping a process, typically you will find that mapping the process, you will get lots of steps. And if you evaluate each of these steps, not every step is adding value. So you will find a lot of things which are waiting. There are waiting times. Every process has, we are waiting for the approval. Transportation, bringing things from one place to another place, the transportation, that is a waste. Overprocessing means doing something more than what is required. Inventory, work in process inventory also is included here. Rework and rejections and defects and errors, underutilized resources. Let me take an example from a hospital. So I'll try to give examples from various industries. And let me take first an example from a hospital. And if I take an example from a hospital, let us say, so I'm trying to give you the, the wastes present in any environment. A typical healthcare, you have got high volume, high variety, high variations, high speed, high stress, high turnover, it is highly regulated, right? It leads to service breakdowns, wasteful processes, and medical errors. So let me talk about wasteful process, because I'm trying to introduce you to the lean. In the lean, it's a war on waste. So some of the wastes are obvious, like motion, walking, searching, waiting, transportation. They are all wasteful steps. Everyone knows. But there are lots of things like overcapacity, undercapacity, extra man hours, extra files, extra paperwork, inventory. They are all related to 7 wastes. So what are the 7 wastes? Waste of intelligence, waste of rework, defects, errors, waste of waiting, waste on inventory, waste of motion, waste of transportation, waste of overproduction, and waste of overprocessing. Now, to remember this, sometimes you can use, this is I swim to. This is one way of remembering. Another way of remembering is just rearrange these words in a little bit differently. You will get Tim Woods. Or if you rearrange these words again differently, you get downtime. So this is one of the ways of remembering the 8 wastes. We also call them as muda. Muda means waste in Japanese. So some of the wastes are obvious, but some of the wastes are hidden. How to find the hidden wastes? And I'm not talking about only one industry. These wastes are present in all the industries. So typically, if I take, when you go to a hospital, there are different steps you perform just to get a blood test. But what is the value we are looking at? Why we are performing a blood test? So if you look at the reason you are performing a blood test is you want to know the health status of the patient. You would like to know what is the status of my health. If you are going for a blood test, you would like to know what is the status of my health. And walking to the OPD, registration in OPD, walking to the lab, waiting for the phlebotomist, these are all not adding any value. Although you may say that, to get the lab results, you have to fulfill these processes, but they are not directly adding any value. So there are only 2 steps: drawing blood and blood test processing. They are the only 2 steps which are adding value, and remaining are non-value added steps. Now, we're not saying that when you say that walking to the OPD is a non-value added step, then that means you have to actually stop doing that. We're not saying that. Given the current restraints of the technology, we have to go to the OPD. Registration in the OPD is required, but it is not adding any value. So one day will come when you don't have to register in the OPD. And a lot of hospitals we have consulted in Middle East, where we have eliminated the registration process in OPDs. Walking to lab, not required. So similarly, if you see, earlier transferring the money from one person to another person using bank, you go to the bank, then you fill in a form, then you wait in the queue, get a token. All these were non-value-added activities. What was the value there? The value was transfer of wealth from one person to another person. But what was happening? You first go to the bank. The going to the bank was transportation waste. Then filling in a form was over-processing. Getting a token was over-processing. Waiting for your turn for the token number to be reflected on some board is waiting time. It's again waste. So every process has got lots of waste incorporated into it. And these 7 wastes or 8 wastes, as I showed you, are present everywhere in all of your processes. So think of your company, think of your department, think of your organization, and you will get these wastes. Some more examples. In one of the hospitals, 80% of the nurse calls from inpatients were housekeeping in nature. Means what? It is waste of intelligence. The nurses are there to take care of the patients. But when you are looking at the when you are looking at the activities performed by the nurses, you see that 80% of the nurse calls are housekeeping. Means patient is telling my house, my pillow cover is dirty, my bed sheet is dirty. And this is a wastage of intelligence of the nurse. All of us, look at your work during the whole day. 50 to 60% of the work is not related to creativity and innovation. 50 to 60% of the time is spent on just answering routine emails. That is known as waste of intelligence. Same thing is happening here in case of the nurse. The nurse intelligence is getting wasted. And when the nurse's intelligence is getting wasted, obviously, it is going to a waste and a cost to the organization. That thing can be taken care of by someone else. Similarly, if a surgeon is waiting for the operation theater to get ready, that's an example of a waste. So these are some of the examples of how lean, applying lean, removing the wastes, studying the processes, making a process map in detail, doing a Gemba investigation. What is Gemba? Gemba is going to the field, go to the place of action. In Japanese, Gemba means go to the place of action. See how the things are being performed. And once you map the processes as they are, once you map the processes, you list down all the non-value added steps, try to reduce them as much as possible. It's not always possible to eliminate all the non-value added steps. We have to agree. No, you can't eliminate all the non-value added steps, but as much as possible, whatever you can eliminate, try to eliminate them. And that is what can bring a lot of improvements in your organizations. So here, a hospital could double cardiology lab capacity from 8 to 16 by redesigning the workflow, by reducing the wastes. Diagnostics to exam time was reduced from 2,700 minutes to just 64 minutes, but by just changing the processes. So Deming said that problems are in the processes, not in the people. Dr. Deming said the problems are in the processes, not in the people. That means focus on the processes rather than badgering the people to perform better. One of the organizations, we reduced the approval signatures from 17 to 7. Approval signatures, you see, approval is actually not any value. You'll be surprised to know, and you will be not, some of us will not be happy to learn that. Approval, the process of approval is not adding any value to the process. But we have to have approval because sometimes we don't trust, and sometimes there have been frauds. Some errors have taken place. Toyota, the car manufacturing company, they used to have a lot of inspectors. People are checking the car, they're checking each and everything. They're checking engine, headlights. Can you guess what they would have done? Can you guess what they would have done? They would have focused where? Should we focus on inspection and checking, or should we focus on processes and inputs, process measures, structural measures, input measures? Where should we focus? We should focus on processes and inputs. And that's what they did. They started focusing on processes and inputs, and they found that they could eliminate the inspection altogether. With confidence, they started producing great cars, and the inspection, which was non-value added activity, was reduced. We can't eliminate normally. Although we should acknowledge that inspection is not adding value, it's a muda, it's a waste, but we can't eliminate altogether. So that's waste, right? So we need to create value. So this is a typical patient flow in a hospital. And we start identifying what is value added, what is non-value added. So this you can map for your own process also, not necessarily in hospital. You can think of your own industry. Map the process. Some of the steps are adding value. So value added, non-value added, value added, non-value added. You will find sometimes 60 to 70% of the time is spent in non-value added activities like waiting time, reworking, anything starting with rework, review, they are all waste. And value stream mapping, value stream map enables that. Just to give you a little bit of idea how a typical system look like, and you can try to fit this into your organization. Think of your own organization. Typically, how a system, an organizational system looks like. You have got a set of processes. Yeah. You have departments A, B, C, D. They are taking some inputs and they are producing an output. They're producing an output. Output is either a product or a service. It is either a product or a service. Think of your organization. Either you are producing a product or you are producing a service. Sometimes you are producing capability to provide a service, or if you are sometimes you're producing a mix, both product and a service. Now, typically, some measures will be very, very important from customer's perspective. And the three measures are always very, very important. What are the three measures? The three measures are the cycle time to complete any activity. Then the errors in that particular process. And then it could be costs. Cost incurred to produce 1 unit of service or a product. Then there could be something very, very specific to your kind of industry. So, for example, if you are, let's say, manufacturing chocolates, so the weight of the chocolate could be one of the measures. If you are in a hospital, infection rates could be one of the measures. Measures, and we call it as quality measures, and in Lean Six Sigma, we call it CTQ, critical to quality characteristics. Critical to quality characteristics. CTQ, critical to quality characteristics. So these three usually you'll find everywhere in almost all products and services. And after that, apart from that, you'll have certain other measures too. Now, these measures are important from the point of view of the customer. Yeah. So we have a customer which consumes this output. And these inputs are coming from the suppliers. Yeah. And typically you will have these customers giving feedback about your output. And also, this feedback will be received by your strategy team, which are making the plans, strategic plans. And they will ask the suppliers to provide those inputs so that the customer is satisfied. So customer is satisfied or dissatisfied based on those CTQ measures. And typically, if the CTQ is coupled with the quality characteristic, if it is coupled with the quality some target value. Say, for example, let's say cycle time of completing a job should be less than 30 minutes. So this we call it as KPI. So we have a CTQ and we have a KPI. Error should be less than 0.01%. This becomes a KPI. Cost per unit of my service should be less than $1.3. This becomes a KPI. So this particular approach of looking at your organization as a system is known as systems thinking. Systems thinking, given by Dr. Edward Deming. Dr. Edward Deming was a quality guru who said that the problems are in the processes, not in the system. So if I want to satisfy my customer in terms of my measures, where should I focus on? I should focus on the processes and the inputs. We call it as process. So take S from suppliers, I from inputs, P for process, O from outputs, and C from customers. You get something called as CPHQ, which is a very, very important tool in quality. So whenever you're thinking of improving anything in an organization, the first thing is you have a process approach, and to have a process approach, best is build a CPHQ. So I'll come to that. Just I will take it from here after a while. But now let us go back to our examples which we were giving in healthcare. So let me give you some examples of wastes in a hospital. Then I'll come back and I'll do an improvement project of recruitment cycle time. We'll try to apply different tools like CPHQ, project charter, cause and effect diagram, Pareto analysis. Now we'll learn these tools and we'll start applying these tools to a particular project. So these are some of the examples: unnecessary process, motion, unnecessary waiting, unnecessary transportation, errors, unnecessary stocks in production. A person who's underutilized is a waste. Person who's overutilized is a waste. Person in an equipment which is underutilized is a waste. An equipment which is overutilized is a waste. Cost of 5-minute MD walk is a waste. Now we have got walk to elevator, elevator wait, elevator travel, walk to lab or pharmacy, nurse cost per hour, cost of 1 trip, cost of 5 trips per day per nurse. So you'll see that everything has a cost. So even moving from one floor to another floor comes at a cost. Why not we reduce these costs? We need to reduce this cost as much as possible. Okay. Okay, now lab, pharmacy, second floor, radiation equipment, ground floor. Yeah, radiation equipment, lab, pharmacy on the floors. Yep. This will reduce our movement. Similarly, let me give some more examples related to, and I'll come to the different industries now. Let us say errors. We want to reduce the error. Visual management. Visual management can be one of the ways to reduce the errors, like, in healthcare. So first few minutes, I just wanted to give some healthcare examples. And these healthcare examples will help you to understand some of the basic concepts. And after that, of course, I'll take examples from other industries as well. So alerts on error-prone products. A visual approach visual approach, visual control will help you to reduce the errors in the system. So try to have these kinds of visual controls in the system as much as possible. One concept is for pokayoke. Pokayoke means even by mistake, you cannot commit a mistake. So prevent those mistakes, you can use visual controls. So you will not forget anything if you use an indented surgical instrumental tray. Pokayoke is a concept in lean where by mistake also you cannot commit a mistake. For example, it will switch off after a particular temperature is reached automatically. That means what will happen? We will be able to prevent the rice from burning. So even by mistake, the rice will not be burned. So similarly, in in healthcare, you have got some examples like oxygen cannot be connected to nitrogen cylinders, and fixed number of gauge packages during the surgery, complete catheter kits for insertions, and prepackaged medication card with correct dosage. So these are all some examples of applying. Okay. So I just wanted to give some examples related to healthcare industry. Now let us come back. Let us try to do a project, a DMAC project. And to do a DMAC project, before I proceed with the DMAC project, let me also tell you who are green belts, who are yellow belts, who are black belts, who are master black belts. So there are different types of levels: yellow belts, green belts, black belts, and master black belts. Yellow belts are the people who know the uh, general general terminologies of what is Six Sigma, what is lean. You will be yellow belt after a while. You know what is DMAC. You will know right now. You know what are 7 or 8 wastes, etc. But you can't do a project. Green belts are the people who can do the projects. Who can who can execute the project, who learn the tools and techniques. They don't not only learn the tools and techniques, but they can apply these tools and techniques to in real life. The black belts are those people who can do the bigger improvement projects and who know a little bit of more high-end statistical tools and techniques. So typically, yellow belt is around half a day training program. Now, without a break, if I conduct a yellow belt training like this, it becomes half a day only. And if you see this program at a slow speed, it becomes 1 day. If you rewind and go and see, this program will be recorded, and so it's being recorded, and you'll be getting the recording. So later on, you can watch this program as many times as you want. Now, talking about the green belts typically takes 3 to 4 days of training. So we conduct the green belt training program for 3 days, typically on weekends, or so we have some batches in the evenings, 2 hours every week. We'll run for 2 hours, Monday, Tuesday, Wednesday, Thursday, and Friday in the evening, or some people prefer morning batches, 2 hours. They can join those sessions. You are most welcome to join those sessions. After the end of this program, I'll give you the links and you can join those sessions. Now, the green belts can do the improvement project. Black belts, again, attend 3 more days of training. Now, when I say 3 days of training, 3 days of interactive sessions, plus we give a lot of content to you. You can play that content, you can do the exercises, so that if you want to further hone your skills as a green belt and black belt, you can do these exercises, and this will be additional, some good amount of work for you, which again will take around 2 to 3 days. Now, the green belts and black belts, typically, so 3 days of green belt and 3 days of black belt training will make you a black belt. We do an improvement project in the classroom. The way Today in yellow belt, I'll be showing you the project. But when we do the green belt and black belt, we do the project together. And then master black belts are those people. Master black belts are those people who are the people who would be able to launch Lean and Six Sigma in an organization. And typically, Lean and Six Sigma can be implemented in an organization. When you are launching Lean and Six Sigma in an organization, you have to train green belts and black belts. You have to allocate the improvement projects. So the improvement culture in an organization can be established in the best way when the leadership support is there. So organizational leadership support should be there. And they should be promoting improvement projects. Now, how would you do that? It's very easy to talk about philosophies of process improvements. You will hear the senior managers telling, well, we should change the culture of the organizations. We should build up improvement culture in the organization. But how are you going to do that? You can do that by converting your improvement opportunities into projects. You have to choose the right projects. You have to list down all the projects, the various projects. There are various techniques. I'll not be describing those techniques right now. There's a technique called Q metrics, where you list down the criteria of what you're going to, what kinds of criteria you'll be choosing to select your projects. You assign the weights to each of the criteria and then evaluate all the possible projects against those criteria and get final result, like which project you should be going for. So all these things are done by master black belts. Or the quality, if you are in hospital, it could be a CPHQ. If you are a PMP, then as a project manager, you will be guiding the people to follow these tools and techniques. So master black belts are the people who launch the Lean and Six Sigma in the organizations. We do conduct, and we are one of the very few companies in the world which conducts master black belt also. So green belt, black belt, there are a lot of companies, but master black belts, very few companies. And this 4 or 5 days of master black belt enables you to become a consultant, an independent consultant, an official independent consultant. And even if you want to become a trainer, you can become a trainer too. And you are authorized to conduct it. In fact, you can, a lot of people certified by us as master black belts, they are running their own consulting companies. And sometimes they do conduct the trainings and they get the certifications from Anexas Europe too. So there are a lot of people, some of you might be knowing as well. Now let us understand the DMAC technique of Lean and Six Sigma. So define, we learned SIPOC. Briefly, I talked about SIPOC. We have project charter. Then we will also learn about types of data. We learn about the normal distribution. We learn about control charts. We learn about cause and effect diagram, Pareto analysis, box plots, scatter plots, process mapping, brainstorming, 5S, and Pokayoke. Pokayoke I talked about briefly. So let us learn these tools and techniques. The best way to learn is by doing a project. So let us imagine that we are doing a project. Let us imagine that one organization wants to reduce the recruitment cycle time, and we will apply DMAC methodology. We'll apply DMAC methodology. Define, measure, analyze, improve, and control. Define, measure, analyze, improve, and control, DMAC. In the define phase, we will define the problem statement and the goal statement. In the measure phase, we will collect the data. How are we performing? How are we performing? In the analyze phase, we'll see why we are performing like that. What are the causes? And we'll zero down on some root causes, doing Pareto analysis, etc. And then in the improve phase, we will find the solutions to our problems. And in the control phase, we will sustain the gains. Right? So let us see this one by one. The first one is we make a CPHQ. So we are here to reduce the recruitment cycle time, and the problems are in the processes, as we saw. So we should first make a CPHQ, right? First, we should also form a team. Now, the team undergoes 5 stages. The 5 stages are forming, storming, norming, then performing, and then adjourning. Forming, storming, norming, performing, and adjourning. There are 5 stages. First, you form the team. When you form the team from interdisciplinary team from various departments, they will not start working on the project immediately. There will be storming. Storming means people will have a lot of questions. Why I'm there in the team? Why the other person is there in the team? What is my role? Storming happens a little bit. Then comes norming. People start accepting each other, and then they are ready to perform. And then finally, we adjourn the team. So we have got a team. We also identify the sponsor. Sponsor is the person who is the head of the department in whose process you are doing the project. The sponsor or the champion, HR director. Here will be the sponsor. Process owner is the person who owns the process in whose process you are doing the project. And the master black belt is the person who's guiding the project. And the team, the green belts and black belts, are the people who are doing the project. So first we start with a CPHQ. When you do a CPHQ, it's always better to do a CPHQ from right to left. So identify your customers. Here the customers are the departments for whom we are recruiting. Then the recruited employee is the output. Then we look at the process steps. We look at the process steps where we look at the basic 4 to 5 steps, high-level process steps, which are leading to the recruitment. And then we look at the inputs. We look at the inputs. And these inputs are coming from some suppliers. So we call the suppliers and input measures as structural measures. The process measures as the process measures. And the output measures as outcome measures. Yeah. We also name them as Y. These measures on the output. What could be the measure on the output? Recruitment time. Or the quality of the recruited employee. Or whether it is right or wrong, or correct or incorrect. Right? Similarly, the process measure could be time taken to interview the candidate. Time taken to develop the mobilization plan. Or here input measure could be a CV is available or not available, percentage of CVs available, budget is approved or not approved, HR staff skilled or not skilled. So these are the input measures. So these collectively are known as X factors. We call it as X factors, right? So we call this Y is function of X. We say Y is function of X. Y is the output, and output depends on the X factors. Just remember that part. So we have created our CPHQ, we have developed our process map. So this takes us away from the silo-based thinking. When you are looking at your own department, always you're thinking in terms of a silo. But when you are looking at the overall systems map, systems thinking, make a SIPOC, your vision opens up. Now you have to collect the data. Now let me tell you, when we tell people to collect the data, there are two responses, that some data can be measured and some data cannot be measured. Now let me tell you, there are three rules. The three rules are, you can't improve if you cannot measure. The second rule is, you can measure everything. Continuous data generally can be represented on a number line. Yeah. It like something like procurement time, cycle time, age, height. And these are all continuous data. It will always have a unit and it will have a possibility of a decimal point. So typically a number line runs from minus infinity to plus infinity, and any point on that line, like for example 55.5396, is a continuous data. So that is why we call it as continuous data. And what is attribute data? Attribute data is categorical in nature. Male, female, good, bad. So if I want to, let me, look at this. There are two types of data: continuous data and attribute data. So I'll tell you the trick to measure anything in your company. Now, what is the trick? I'll tell you. So first, obviously, as I was talking about continuous data, let me give an example here. Our recruitment cycle time. Recruitment cycle time. Recruitment time is how much? 50.2 days, right? It is continuous data. Average age of people whom we recruit, 29.3 years. Again, continuous data. Cycle time, patient waiting time in my hospital, 32.3 minutes. And these are examples of continuous data. Now, attribute data is something which we think we cannot measure. So what is the trick to measure? Just think of the attribute which you want to measure. What you think cannot be measured, just put that. So can you give me an example of something which you think cannot be measured, which is very difficult to measure? And I will give you the trick. And this you can apply to any measure. So attribute, category, count, proportion, and then percentage. Yeah. So can you think of something? So people are telling happiness I cannot measure, motivation I cannot measure. Oh, so I'll tell you. I'll tell you. Any other thing which you think cannot be measured? Anything which you cannot be measured? So whenever you are doing any project, you have to measure. Quality measures are important when you are in terms of deliverables of your project as well. When you're trying to improve something in your project, when you are delivering something in project, the KPIs are there. Unless you measure, you're not going to deliver anything. Yeah. Loyalty of the candidates, some people are asking. So whatever you have given, satisfaction. So let us take one thing, happiness, right? I want to know the happiness of our employees in our company, how happy they are. So similarly, thing goes for loyalty, things will go for honesty, things go for satisfaction, everything. Create a category. Now, easiest way to create a category is, there are two ways to create categories. Like two categories you can always create: presence or absence of that attribute. Whatever you have listed here, you have listed happiness here. So presence or absence of that happiness. So I can say happy and unhappy. Yeah. So out of 100 employees, I checked with 100 employees, 60 people said happy and 40 is unhappy. 60 were happy, 40 said unhappy. Proportion is 0.60 and 0.40. This is 1.00. So proportion means portion. Portion means one part in the one. So one means a circle is one. If you consider the circle as one. So what portion out of one belongs to happiness and what portion belongs to unhappiness? So it is 0.6 and 0.4. That is proportion. In statistics, in high-end statistics, as we will see later on, you will always find that we talk in terms of proportion, not in percentages. Percentage means what? Out of 100, what portion belongs to, say, happiness, and what portion belongs to unhappiness? 60% and 40%. So this is all about your 60% and 40%. So it is about 100%. Okay. Similarly, think of whatever you gave, loyalty, loyal, not loyal. Now, these are perception based. Of course, we have to understand that they are not exactly like very objective measures, but at least they serve the purpose. Like, for example, if I want to increase the happiness of the employees in my organization, I at least get an idea that today 60% of the employees are happy, and I can take up an improvement project. See, we are talking about improvement, process improvement. I want to take up improvement projects, and I can increase the happiness to from 60% to 80%. So that is very much possible. So that is why we say that 60 to 80% improvement will be possible if I measure the happiness. Otherwise, we'll keep on thinking of increasing the happiness in our organization forever. Next week also, next month also, next year also, we'll have the same goal, but we'll never be able to increase the happiness. But now, once we measure, we can start thinking of improving the happiness index in our company. Now, let me also tell you one more thing. When we are measuring in terms of continuous data, we will interpret this as a histogram. We can make histogram. Histograms means historical graph. Histogram means historical graph. I collect the data, let's say age of my employees. You'll find that it has an average. Always it has an average, and always it will have a standard deviation. It will have a standard deviation. Okay. This was found by Carl Friedrich Gauss, one statistician or one. He found that any repetitive process, like if I'm doing recruitment again and again, any repetitive process, if I'm trying to do something again and again, it will follow this type of distribution, which he called it as normal distribution. Normal distribution. Why? Because it is usual, it is natural, it is normal to obtain a normal distribution. That's what he said. That's why this is a normal distribution. So typically you'll find that your continuous data follows normal distribution, which has an average and which has a standard deviation. And he also found that within plus minus 3 times the standard deviation, lies with lower control limit and upper control limit. Within plus minus 3 times standard deviation lies the total population. Means I have collected 30, 40 samples of waiting time of patients, let's say 30, 40 samples of patients. And their average is, let's say 30 minutes. So average is 30 minutes and standard deviation is 5 minutes. Sorry, I think there was a break. Sorry for that. So here, no, I'll just repeat this last part. So see, if my average is 30 and standard deviation is 5 minutes, and standard deviation can be easily found out using the Excel sheet or Minitab. I'm not going to give in the details about. If you come to my green belt and black belt sessions, I will teach you how to what is the significance of standard deviation, how to collect the, how to how to derive the formula for standard deviation. We will also see that. But for the time being, just understand that standard deviation can be very easily calculated using Excel sheet. So if I have the average as 30 and standard deviation is 5, then in that case, I can predict the whole about all the waiting times of all the patients. So 30, 35, 40, and 45. So plus 3 times the standard deviation is 30 plus 3 times 5, that is 45. And here it will be minus 1 sigma, minus 2 sigma, and minus 3 sigma. So here it will be 25, 20, and 15. So I can say almost all the 99% of patients in my hospital, they wait for between 15 to 45 minutes. How? By just collecting 30 samples of the patients. I will expand on this. I'll take one more example. Again, I'll take the similar example. Keeping the numbers as 30 and standard deviation as 5, I'll take one more example. But for the time being, let us look at the attribute data also. Now, attribute data, I cannot make a histogram. For attribute data, I can make a bar chart, like happy, unhappy. Or I can make a pie chart, which we made it, right? Happy, unhappy. Yeah. So bar chart, pie chart to be represented. And how will you report your metrics? When you collect the data, you have to report it. So you have to report as bar chart or pie chart when the data is attribute, and you have to report as histogram when your data is continuous data. Okay. Now let us go back. Let's go back to our project. So we have understood there are 2 types of data. Now we make a project charter. We are in the define phase. We make a nice project charter. Now, project charter will have a problem statement. It will tell you what is the problem, where is the problem, since when is the problem. It will not tell you why is the problem. See, please understand, don't write the reason. Don't assign a reason. Just state the problem as it is. So what is the problem? Since when is the problem? How big is the problem? But don't blame anyone and don't assign a reason. Don't tell why is the problem. That is your problem statement. And in the goal statement, what will you have? In the goal statement, 50 days to be reduced. So it has to be smart, specific, measurable, relevant, and achievable and relevant in time bound. Specific to the problem. Measurable means reducing recruitment time from 50 days to 30 days. It's measurable. Achievable, I think I will achieve it in 3 months. Relevant to the strategic business objectives of the company, vision statement of the company. And time bound. Time bound means it should be having a time, like by July, like in the next 3 months, I'll reduce my recruitment time from 50 days to 30 days. So you are very specifically telling that there's a timeline associated with that. And also, if I achieve that, I will be able to save some money for the organization. So that's what we are looking at, the savings. So we look at the savings. What are the savings we are looking at here? So if I am able to recruit the people fast, I'll save some good money for the organization, and you can write that. So these are the typical elements of a project charter. And once we have got the charter, now in the measure phase, you start collecting the data. Now you start collecting the data, you look at the symptoms. So why is the symptom? Why is the output? Output measures, outcome measures. And these are the X factors. Now, when you go to the doctor and you tell, like when I go to the doctor, I tell the doctor I'm having fever. So fever, how would, and doctors applying, let's say 6 sigma, he will say, well, I cannot improve if I cannot measure. So he first measures. What is the CTQ here? CTQ, or critical to quality measure here? The body temperature. He measures the temperature and he says, well, you are having 101 degrees Fahrenheit or whatever, 37.8 degrees Celsius is your Y. But he doesn't try to work on the Y. He doesn't just try to reduce the body temperature. He doesn't tell me to sit in the refrigerator for some time and come out and reduce the temperature. He doesn't do that. He actually collects the data and finds the root cause. He takes a blood test, he goes X-ray, etc. And then he finds the root cause and he gives the medicine to the root cause. Similarly, as a green belt or a black belt or a CPHQ professional, you are a physician to a process. You are a doctor of a process. You're trying to, people are coming, process owners are coming to you saying that, well, there's a problem in the process, there are delays, there are errors, and you would like to reduce those delays and errors and costs. And you as a doctor will prescribe the medicine, but you won't prescribe the medicine unless you do the root cause analysis. So how to do the root cause analysis? So collect the data on Y as well as the X factors. So how to find the X factors? We can make cause and effect diagram, right? By the way, I showed you how to make a histogram. There is a tool as a green belt which we learn. Generally, when you join our session, we also give you the this tool called Minitab, and this is very easy to operate, and everyone can learn in just 1 hour or so, 1.5 hours or so. And by the way, some of the CPHQ professionals have also joined us. If they want, they can go back to 5:30. I'm not sure what's the situation there, but just stay connected with my team so they can join back our regular session. Because some of you wanted it that way. So yeah. Now 4 means 4. Sorry, 4 means your time. Your country's time. Yeah. So yeah. So actually, I would have loved you to stay here for a longer time, but I think some of you are telling that they would like to go back to that regular session. So up to you. I think let's follow that. Okay. So now I was just as I was telling, let me show how easy it is to make histograms. See, the idea nowadays as a quality professional, you don't have to really make those charts and graphs. You should be able to interpret those charts and graphs. Making charts and graphs is very easy. They're given by your softwares, etc. nowadays. So let's say this is recruitment cycle time, and I just make a histogram out of it. And it tells me that average is 50 days. Standard deviation is around 5 days. So that is how my graph looks like. Typical histogram will look like. Now, once I've got this, we will learn the concept of control charts also in a short while. Just give me some time. We'll learn a concept of control chart also in a very, very short time. But let us also see how a control chart, or what do we mean by a control charts. So when you are, if I take an example, if I try to keep the same values of 30 and standard deviation of 5, let me try to give an example of that. To save time, let me play a video, and this will explain you the concept of common causes and special causes. So let us understand, see, minus 3 times standard deviation and plus 3 times standard deviation, these values are known as lower control limits and upper control limits. Okay, LCL and UCL, lower control limit and upper control limit. So if I were to say, take, let's say, yeah, so I'll just show you same example in order to explain to you what exactly we mean by process under control. What is process under common causes? Let me take a simple example of a typical process of, or day-to-day example I'm taking. I want to go to.
So if you want to change, if you want to make changes, go ahead with it. And your data collection plan should be.
So I'm taking an example of going to office every day, and I'm going to office and I start collecting the data of my process.
Of what is control chart, let us take a simple example. Suppose I collect the data of my travel time from my home to office every day, and I find that on an average I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be minus 3 sigma limits, that will be 15 minutes, and upper control limit would be 45 minutes, that is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes. Means all the causes are acting on my system and producing this variation.
So once again, just to give you a little bit of idea what's happening here. So I get my lower control limit and upper control limit, the LCL and UCL, that's what we say, which is defined by as a voice of process. Now, this is the performance of my process. This is how my process is performing. Lower control limit is 15 minutes and upper control limit is 45 minutes. And typically, you'll see the natural variation behaving within 15 to 45 minutes. I cannot start Someone asked me, you took for 20 minutes yesterday, today you took 25 minutes. What I will explain, I will just say it's a natural variation. There is no Sorry, I think there was an interruption. There are certain disruptions due to internet at our end nowadays. So today is a very bad day, I would say. So please bear with us. And there have been some multiple issues. But it happens when we have to move on with that. Yeah, so coming back. So as I was telling that there is a difference between common cause and special cause variation. Now, when we are talking about a common cause, if you start trying to search for the causes, you will be wasting your time. If I take, let's say, think of, your operations, productivity or production or sales. Let's say instead of 45, it's 45,000, say, tons per day of production, or $45,000 of sales. And here it is $15,000, $15,000 of sales. So 45,000 to 15,000 is our sales. This is the natural variation. So don't be happy if you achieve one fine day 40,000 and next day it goes to 30,000. That's the natural variation. Don't try to search for the reason. But most of the managers, they keep searching for the reasons and waste their time. In fact, whatever has gone up will go down. That is the reasoning of a green belt or a black belt. But does it mean that I should not do anything about it? No, that doesn't mean. But before I go further, let us also understand what is the special causes. What do you mean by special cause? The special cause is something which...
This is known as voice of process, as if my process is telling, my traveling process is telling that I will take between 15 minutes to 45 minutes. Now, if I take 60 minutes to travel to my office, then same question is asked to me, that why did I take 60 minutes? Then my answer won't be that all the causes are acting on my system and producing this variation of 60 minutes. I might be able to point out a cause. We call it a special cause. So I may say that I took 60 minutes because maybe today there was too much traffic on the road, or it can be any factor. So when I go out of control limits, I can specify a special cause, and we call this variation as a special cause variation. So we have two types of variation: common cause variation and special cause variation.
So the common cause variation is that variation which is always present, and I don't have to act on it. The special cause variation is something I have to immediately act on it. So if you're a project manager and if you see some procurements taking long time, extraordinarily long time, you find the special cause for it. But the common cause doesn't mean that you should just relax and do nothing about it. In such situations, you can still work, and there you have to do a DMAC project or an improvement project or a process improvement project, choosing those techniques. So what you will do in such situation, let's see.
Common cause variation is part of the process, part of the natural variation of the process. And special cause variation is assignable variation. I can assign a cause to that particular event. Now, what is the difference between common causes and special causes? For special causes, you need to take immediate action. Means you need to take a prompt action so that you are able to bring the process within control. But for common causes, you should not take any specific action. Usually, the common cause is within the control limits, and If you want to act upon the common causes, you might have to change the control limits, and changing the control limits takes effort. You may have to do a DMAC project. You may have to do a lean project. You may have to do a Six Sigma project, and that's what we are doing. That is why we say that lean and Six Sigma is applied to chronic problems. A process is behaving in a certain way. It is behaving within some control limits for a long, long time. Last 6 months or 7 months, your procurement time has been, say, 120 days plus minus 30 days. And I would like to change the control limit. I would like to change the DNA of my process. And that is why I would need to do a Six Sigma project.
So this one, let me reiterate. So if the process is under control, doesn't mean that it's satisfying the customer. See, process under control just means that it is, stable process. It is within a particular range. It is not giving me surprises. But the idea is to satisfy the voice of customer. Now the customer is telling that, you should, let's say if this is waiting time for a patient or waiting time for your customer to process some claim or some, one of your cycle times of your processes, or delivery time of 15 days to 45 days of particular item. The customer says, no, I want it in 20 units. 15 units to 45 minutes is that's how you are operating today, but they want it to be less than 20 units. Then you have to bring your process somewhere below the customer's right. We call it as upper specification limit, SL. So please remember, this is LCL and this is UCL. This is lower control limit and this is upper control limit. LCL and UCL, and this is SL, upper specification limit. The specification limits are set by the customers. Yeah, specification limits are set by the customers, and control limits are set by the processes themselves. The way you train your people, the way you maintain your machines, the way you create your SOP or follow your standard operating procedures, that defines your control limits. The name is little misleading, I would say. Control limits means, I have to maintain my process within a certain limits and customer would be happy. Actually, unfortunately, control limits is not that. The specification limit is that limit within which we should operate. But the control limits are the limits given by the process. Means it's the voice of the process. Process tells you that I'm operating within this limit. So taking that, if I just go back, if I take the example of our recruitment time, I can very easily make a, now you don't have to worry too much about how I'm doing and what I'm clicking, because when you join my Greenfield session, you will be able to learn all these things, you'll be learn this very easily, you'll get to know these tools and techniques. Just few clicks, you can get your control chart. But for the time being, I'm just making it for you. So that you know the concept. Right now, I'm here to explain the concepts. So I can see that, my control limits, lower control limit is 36 to 64. 36 lower control limit and upper control limit is 64. So my process is behaving between 36 days to 64 days, plus minus 3 times standard deviation. That's how my process is behaving. And this is my current status. And I would like to reduce it further. The idea would be to improve the process. Now, how will I improve the process? Of course, by analyzing the root causes. How will I analyze the root causes? So there are two ways to analyze the root causes. One is process door and one is data door. Process door is the one I showed you in the beginning. I gave an example of a hospital. Like we made it as this process map. We do a Gemba walk. Gemba walk means we go and see how the things are taking place. And we identify the value added and non-value added steps. What is the wasteful steps in the process? And we try to reduce them. And then in the data door, we identify we do a cause and effect diagram, we do a control impact matrix, we do a Pareto chart, box plots, and scatter plots. So first we do a process map. We generally make a process map of all the steps, all the possible steps, which I can think of in the detailed way when I'm recruiting. And then each and every step I evaluate whether it is value added or whether it is non-value added, VA and NV, value added and non-value added items. Value added and non-value added items is something which generally is based on, as I told you, the 7 or 8 wastes. And I can also do one more thing called escape analysis. Escape means, can I eliminate? I ask these 5 questions. Can I eliminate? Can I simplify? Can I combine these steps, 2, 3 steps together? Can I automate that step? Or can I make these steps parallel? So asking these 5 questions on each and every step, maybe 2, 3 hours, 4 hours, you do this session with the help of your team members, you can come out with totally new steps. You can come out with totally new, brand new process in just 4, 5 hours. Make your boss also sit there so he can even approve all those changes. And you will come out with a brand new process which reduces the cycle time drastically. You'll be surprised to look at those types of improvements. So that is known as process door. Map the process using Gemba investigation, identify the waste, try to reduce the waste as fast as possible. And the other one is the data door. The data door, you actually do the cause and effect diagram. You collect the people, get hold of the people, and try to get all the possible causes, get to brainstorm on all the possible causes. And once you brainstorm on all the possible causes, then list those possible causes into or we can classify them into man, machine, material, method. There are 6 M's, we call it as man, machine, material, method, measurement, and mother nature. So when you are brainstorming, try to think of machine also, measurement also, the 6 M's, and club the similar things together. Now you can't work on all these causes, isn't it? So you can prioritize them. Now, how to prioritize, I'll tell you that as well. But before that, let me show you. It is easy to make cause and effect diagram. So I brainstormed on all the possible causes of my high recruitment cycle time related to man, machine, material, measurement, environment, method. Method, environment, measurement, material, machine, man, machine, material, method, etc. And then I make a cause and effect diagram. So a few clicks, you get all the things nowadays, Yeah. And I make this cause and effect. These are the possible causes. And these are the X factors which are possible causes. Now we are talking about possible causes. Now I have to zero down on some of the causes, because some of the causes will be impacting more as compared to others. So you use Pareto. Vilfredo Pareto was an Italian economist who found that 80% of the money in Italy was with 20% of the people. So Joseph Juran, he applied this to quality. He said that 80% of your problems are due to just 20% of the causes. So you've got, let's say, these causes are there, different, maybe you have listed 20 causes. 20% of 20 is 4. So only 4 causes are responsible for 80% of your problems. The 4 causes are responsible for 80% of your problem. So what you do? What you do here? Just focus on these causes. And I'll try to search for the root causes here. So we are looking at the, we can make a quick voting, and we can collect the votes. The highest number of votes you see are given to upfront CV screening. So idea is that, you start collecting more data, and let me show you it in Minitab. Actually, I collected the data, reasons, most of the reasons. I counted the reasons for each of the delays. I counted the reasons, and you see that, all these reasons, approval time, JD not available, these are listed here. So the Pareto chart, what it will do, it will count the number of times a particular reason appears and arrange them in descending order. In project management, it is highly useful. In operations management, this is also highly useful. So what it does is it compares. So we have the reasons. I'll just ask a Pareto chart. So when I look at the Pareto chart, it sums total how many times assessment time is appearing, how many times job description is not available appearing, how many times approval time is appearing, how many times types of hiring is appearing. Okay. And you can see the top 4 or 5 causes are contributing to almost 80%. See, here assessment time is 13 times appearing, and total percentage contribution is 34%. You want the calculation part also, I can show you, but generally yellow belt, the idea is to give you an overview. So I'm not going into the details of how to make a Pareto chart manually. In our green belt session, actually, we do the manual calculations also, because always good to learn the manual calculations, how to prepare a Pareto chart manually. When you do the things manually, rather than using a software, you learn better. But for the time being a yellow belt session, I'm just giving you the overview. So Pareto chart will list down all your causes in the descending order: assessment time, job description not available, approval time, types of hiring, etc. And then after that, you will look at the top 80% of the causes. So you will see that here top 3 or 4 are constituting around 84%. So I'll just focus on these 4 causes, and these become my root causes. So this is how typically I do my root cause analysis. Now, for yellow belts, it's good enough, but if you want, I can go further. Up to you, how much you want to learn. You want to learn more statistical tools, or you want to learn about how to implement the Lean Six Sigma in an organization? There are 2 options. Now we've got 20 minutes remaining, 25 minutes remaining. So which one? Or I can try to finish both, but you have to stay along a little bit longer, 15 minutes more. Okay, let me talk about both. Yeah. So people are telling tools, they would like to learn the tools, and both. And okay, so both people are telling both. So just wait for 15 more minutes. So if you can wait for, so it will take around 35 minutes more, 35 minutes to 40 minutes more to explain both. Let me first go with the tools. Okay, so let me go with the tools first. So now what do I see here? I got the 4 root causes. If you remember, one is approval time, one is job description not available, one is type of hiring, assessment time, time taken to assess the employees. These are the top 4 causes. Now, are they really the top 4 causes? I want to validate that. I want to know recruitment time, is it really affected by the job description availability, yes or no? Recruitment time, is it affected by approval time? Recruitment time, which I'm trying to reduce, is it really affected by the assessment time? Recruitment time, which I'm trying to reduce, is it affected by the types of hiring? Are they the real X factors? Now, I want to know whether they are really the X factors. I want to validate them statistically. So I will use tools. Now, let me talk about the tools. The 2 tools which you will be using, would be, again, depends on what type of data we are dealing with. If I'm dealing with the y and x, both are continuous data. Yeah, both are continuous. So there are different possibilities. Both are continuous, or one is continuous, one is attribute, or both are attributes. Okay. So let me talk about this. If both y and x factors, both are continuous data, like for example, recruitment time and let's say interviewing time, both are continuous data. So I can make a scatter plot. Okay. And if one is this is recruitment time, and this is job description availability. Now, job description is available or not available is attribute data, isn't it? Available, not available. Yeah, available or not available. Now, job description is available or not available. It is attribute data. So I cannot make a scatter plot here. So when the job description is available, the time taken is less. Job description is not available, the time taken is more. So here, we can make a box plot. The box plot divides the whole data into 4 equal parts, quadrants, we say, quartiles, quartiles. So if the box plots are something like this, like when the job description is available, this is not available. It is available, the time taken is less, and not available, time taken is more. That means job description availability is a root cause, one of the causes of my high recruitment time. So I should make all the job descriptions available in my company, and that will solve my problem. But suppose, now let me give a little bit of another possibility. If the job description available and not available were like something like this, job description is available or job description is not available. In both the cases, my overall variation in the process is almost same. That means I would say that job description availability doesn't really impact. It is available or not available, it doesn't matter. Recruitment time is not a function of job description availability. Yeah, I hope you got the point. Yeah. So I'm using box plot here when I have got attribute data and continuous data. And I'm using scatter plot when I have got both continuous data and continuous data. Again, one more thing, interview time and recruitment time. If I see a relationship like this, there is no relationship. I'll say, interview time is not the root cause. So let us see. Let us try to now explore this data. Recruitment time and let us say approval time. Let us see. Both are continuous data, so I will use scatter plot. Let us see scatter plots. Let's do that scatter plot. Recruitment time and approval time. Yes, it appears that they are related. There's a positive relation. As the approval time increases, the recruitment time also increases. Well, what about assessment time and recruitment time? Let us look at that. Assessment time and recruitment time, let us look at whether they are impacting. Well, it appears they're not related. So assessment time is not the root cause. So I will waste my time if I try to reduce the assessment time, try to assess them, the candidates, etc. It's not much important as against the approval. So approval is the main cause of my delayed recruitments. So this becomes my root cause. Similarly, recruitment time versus, let's say, job description available or not available. I will do a box plot. So let me do a box plot. And job description availability affecting or not affecting? Well, it is affecting. It is. Job description is available, it takes less time. Not available, it takes more time. So that means I should make all the job descriptions available. So one of the solutions in the improve phase would be, I will tell that all the job descriptions in the organization should be made within next 2 weeks. And it will ensure that I will have a great reduction of recruitment cycle times in future by almost 20-30 days. See the difference between the two boxes? Almost 20 days, right? I think around, say at least for 10 days, around 45, 46, and 50, yeah, around 10 days. So I'll be able to reduce my 10 days in my recruitment cycle time by just ensuring the job descriptions are available. Now let's look at the other one. The types of hiring is going to impact. Should I do something related to one certain types of hiring, which is, if it is impacting? Oh, well, it is not impacting, almost all are overlapping, there's no clear, I can't say that. Okay. So expat, local, shareholders, it doesn't matter. Well, that was our analysis. Now let us see, as I promised, you told me you now want both and you are willing to stay for longer time. So let me talk about this as well. And I'm also conducting project management training, and PMP people from PMP project management have joined. A special thanks to them. I hope you have learned from today's session as well. My project management batch, I hope you have learned some bigger picture, the quality tools and techniques which you use in project management. Yes. Okay, Manoj, Mohammed. Yeah. Thank you. Thank you. Thank you for being there. We'll see after a while, after after say 40-45 minutes, we'll again meet in our another session. Okay, great. Now let us take it further. Now, when I have completed my analysis, so this is the summary of your simple rules of analysis. Single column, if I am using, I'll use a histogram, variable data. I'll use a histogram. And for attribute data, I'll use a Pareto chart or pie chart or a bar chart. And then continuous data and attribute data, you have box plot. Continuous and continuous data, scatter plot, and attribute data, Pareto chart. Right? So we conduct the training. Then before I tell you how to implement Lean Six Sigma in an organization, just to tell you, if you are interested in joining our sessions, there is we conduct our sessions, and please join those sessions. Feel free to join our sessions. There's a link for registration if you are interested in joining those sessions. My team will give a registration link. Oh, okay, let me ask you one. Let me take a poll. Before of course, we have not ended, but just wanted to check with you. How many of you are interested in learning further as green belt or black belt? And the recording will be given to you. Recording will be given to you immediately after this session. This link will be sent to you, and you can always watch this program as many times as you want. Yeah, so one thing is remaining to be told, that how to implement Lean Six Sigma in organizations. So I'm going to tell you about it. So so thanks for answering this poll, that how many of you are interested So those who have shown interest, I will send you a mail telling how to register. And the recording, today's training recording link is also given there. You can always have a look there. Yeah. Okay, now let's take it forward. Now, in the improve phase, you will conduct the brainstorming, get the people together, conduct the brainstorming, and you can also do FMEA, failure modes and effects analysis. Now, FMEA is a technique. There's no time to, FMEA takes around half an hour to explain. And along with the exercise, it takes around 45 minutes total. What I'll do is I'll give you a link of FMEA, which is there in your chat box. Just to click on that link, and later on, after the session is over, learn FMEA from that. And it explains FMEA in great detail and also gives you an Excel sheet where you can download that Excel sheet and also do your own FMEA. FMEA is a technique to prevent the failures. You imagine how you will fail and you prevent the failures. That is known as FMEA. So that you can watch later. But now just to continue, we now brainstorm on all the root causes, whatever root causes we have got. So we have got one by one root causes. For each root causes, we are giving solution. I'm not going to describe the solution specific to this particular company, but they took an action on each of the causes. And once they took an action, they reduced their recruitment cycle time drastically. So let me show you that. They reduced the recruitment cycle time, and this is very clearly visible from their control chart. So before and after control chart indicates the shift in the control limits. If you see carefully, the control limits have shifted. LCL, UCL before and LCL and UCL afterwards, they've reduced. That means the process is significantly improved. There is a significant improvement in the process. And this is the slide which every CEO or the department head likes. They want to see this kind of improvements. This is the systemic improvement. System has improved. Yeah. The system has improved. Yeah, so here, if I just go back, yeah. Now, once we have improved, then you have to control, you have to sustain the gains. You have to sustain the gains. How would you sustain the gains? You put audit plans, check sheets, review plans, continuous training plans, so that people get trained and they don't go back to original stage. So that is how you do a project. So this was an improvement project. We were perfectly on time, but as you want to know something more, right? But before I to tell you how to implement Lean Six Sigma in an organization, some people are requesting to tell about our my team members. Can you tell me? Can you share the screen and tell exactly the dates? My team members have got the dates. They only decide. They keep making me work very hard. So these are the generally these are the dates. They keep setting up lots of dates. I would like to relax. Oh no, I love conducting training programs. Just joking. So so again, there are lots of trainings lined up. By the way, I'm conducting, there's a project management training happening simultaneously. After this, I'm joining another session of project management training. The people from PMP batch are there. So I told them to join this session too. By the way, yes. So these are trainings happening on weekends, Fridays or Saturdays or Sundays. Depends on which country you are in. Fridays, some trainings are on Fridays, some trainings are on Sundays. Sometimes we have trainings on Saturdays also. Some trainings are on weekdays, like Monday to Thursday, Monday, Tuesday, Wednesday, Thursday, and Friday in the evenings, 2 hours. So some people want to attend in the morning, so it is in the morning sessions. So please join those sessions. I think the last, the bottom line is not, I can't see that line somehow due to the, yeah. So one batch is starting on June. I'm going to take this session and please join those sessions. 23rd June, 24th June, or so on and so forth. Next one. You can register for the lean and green belt and black belt, and you can also receive our Power BI self-learning course for free. So Power BI course for free if you register for green and black belt. There are also other combo offers available: green belt, black belt plus PMP, green belt, black belt plus master black belt. You can choose. Different combo offers are there. Can you show the next one? So we have got these timings. These are the timings of our training programs, training sessions. So weekends and weekdays, there are different trainings. This is about weekend trainings. And the weekdays trainings are also given. And these are other free webinars. Join those free webinars: PMP workshop, CPHQ, Yellow Belt, data science, Power BI. All these trainings I conduct. Data science and AI. I'm also a data scientist. I do lots of trainings in data science, data, Python related, regression analysis, etc., machine learning. So feel free to join our course. Okay, now, yeah, just to tell you about the so we have done these trainings for all over the world. EDNOG, SABIC, Aramco, etc. So you will be getting real values.
Mr. Andrew Robertson with us, who
National
is the
Healthcare
CEO
Service,
of
hospitals
King Edward VII Hospital in
in
London.
UK, Middle East, lots of petrochemical companies. It's a real value. We are accredited to PMI, ISSC, People Cert, AEC, European certification, so many Australian certification. Anexas itself is a very good brand name, so you'll be getting a lot of knowledge, and please do join our sessions. Of course, this costs a little bit. The certificate, if you just want the certificate to this particular training, it is a very, very minimum, very minimum cost, which you would pay for any lunch or a dinner in a hotel. The same cost you can pay and get a certificate for this training. If you want to join our green belt, then this certificate will come to you for free. Yellow belt session will come to you for free, and green belt, black belt has a cost. Usual cost is this, but total lots of things are being offered: green belt, lean expert, black belt, master black belt, project completion. Everything together costs a lot, but as a special offer, a lot of things come to you for free. Plus, on top of it, there's 50 to 70% more discount on whatever is being shown here. Plus, on top of it, some more discount if you are able to join, if you take a combo offer. So exact pricing, etc., you can speak to our team. They'll be happy to give you lots of discounts. So you are invited to attend my green and black belt and master black belt training. And you will learn a lot, I can tell you. And it's very, very powerful and important certification. And feel free to connect with us. Now, let me show you. And there is a link also. You see, there's a link. Now, let me show you how do you implement Lean Six Sigma in an organization. As I told you, the extra session. Yeah, you're willing to stay on. So I'm just talking about that. See, you identify your businesses and you identify the business opportunities, like improvement opportunities, and convert those improvement opportunities into projects. Lean and Six Sigma improvement projects. So you first form a steering committee, the CEO or the top 4-5 people in the organization or in your location, and the department heads, HOD, head of the departments, will be designated as champions or sponsors. Okay. Then we have black belts. Black belts spend around some time to do the projects, and the green belts, and they also support the green belts, the black belts, and the people like us who would be guiding these green belts and black belts. You also can become a master black belt, as I told you. You can attend our green, black, and master black belt all the sessions and become an independent consultant. Now we train the senior management in basic tools and techniques. And here I'm seeing training the senior management of Novartis in Switzerland. They're getting trained and they're getting convinced. They're getting the buy-in. The first thing is you do a champions training. And then once they are convinced, then they recruit the best of the best team members, best of the best people from their processes. Best of the best people from their processes. And then they come to the classroom to attend the trainings. And when they're coming to attend the classroom, coming to the classroom to attend the sessions, like this. Your team name 1, 2, 3. Anti-Muda. And your slogan 1, 2, 3. Green air go. Okay. And your song 1, 2, 3. Here it goes.
Yeah. All of us were the last one. Let's go team! We are the champions! We are the team!
Wow.
Yay!
And your team name 1, 2, 3. So now these people are learning. They have come to the classroom. Everyone has got the project. And then do the project to 3, 4 months, 5 months time. And then they present the project to the senior management.
Well, we have Alex
got
with
this
us,
person.
and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvement at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Yeah, so people are happy. And then finally, organizations like Bank Muscat, they have implemented NAKIL. Let's hear from them as well. So they did it for 10 years, and they did lots of projects. We did a lot of projects for them. So they transform, the whole organizations get transformed.
My name is Mohammed Al-Bayati. I'm the CEO of NAKIL. Through Anexas, Mr. Amitabh has taught me and more than 1,000 employees of NAKIL, Six Sigma and Lean processes. This affected our bottom lines by millions of riyals, and it is having a big impact in changing our company from a local company to a regional or multinational company. Thanks to Anexas and Mr. Amitabh. Thank you very much.
Yeah, so this is how, typically you do a project. So on that note, if this is how you implement, so we have done these implementation multiple times, many companies. Let us have a look at, so any questions, how to enroll? I'm encouraging you to enroll in our sessions. Let's look at Ferrari World, etc. Can we stop the recording, please?